Well, good evening, folks. It's great to have you here joining us this evening. It's kind of a nasty day outside. I think winter is trying to make its last little poke in the eye at us, but it's my pleasure to have a guest speaker with us this evening. My name is Dr. Richard Michael. I'm with MDVIP in Rocky Mount, North Carolina, and you can see our contact information at the bottom of the screen. For those joining us for the first time, VIP stands for Value in Prevention. And we're going to take a little twist this evening. I have a guest speaker in the studio this evening, Alexander Babineau, and I'll introduce you to him momentarily. But we're going to be talking about a subject, and we're going to interweave his specialty with this topic, and that topic is on the forefront of many of your all's minds. We are in the middle of March. That means 3 months from now, everybody's hitting the beach, everybody's in less dress, and everybody's interested in how they look, right? Come on. I know it's on your minds. That's one of the reasons I brought this subject up. And we're going to address obesity among other topics this evening, but we're going to take a little twist. Alex's specialty is in exercise physiology. Now that's a mouthful for some of us to even get the words out, but let me tell you a little bit about Alex and his background, his training, and what he currently does. Alex is actually locally born and bred. He went to Northern Nash.
That's correct.
And he got his advanced degree in exercise physiology at Greenville. So just down the road, he got his BS in exercise physiology. Then he went on to get some advanced training. He got his master's level in exercise physiology at East Carolina. He then has spent and during that time, he was a personal trainer and a group fitness instructor at the Greenville Aquatics and Fitness Center. He's fortunately made his way back home here, and he has been 2 years with Kelly Singler, who I just adore as a physical therapist group, but they have a fitness center there as well. And I'll let Alex talk to you briefly about that, but he's been there for 2 years. Now, you may wonder what he does in his civilian life. He is with a gal that he definitely has been enjoying, and who knows where this is going to go, but I can't give away company secrets here. But he enjoys working on cars, and in fact, I found out this fact about him, that he does upholstery work on cars and does that on the side. So he's a very busy guy. He enjoys going up to Boone. He has some family up there, and they do some hiking in the mountains. And of course, he enjoys exercise, he said, as a hobby. So needless to say, he mixes pleasure with work and vice versa. So I'm going to let Alex, just if you'll hit a couple of highlights about your current job and what you do there, and then we'll get right on into our subject.
Absolutely. So my job, I'm the head exercise physiologist at the Wellness and Aquatic Center, Manual Physical Therapy. So the Wellness and Aquatic Center that we run is meant to take a little bit more of a personalized, hands-on approach to exercise than your conventional facility. When our members come in, we work with them one-on-one. We sit down and talk to them initially when they first come into us about what their goals are, any types of limitations or concerns that they may have. If they are a former physical therapy patient, we coordinate with their physical therapist to make sure that the exercises they're doing with us, either while they're in physical therapy or after they've been discharged, don't conflict with the treatment plans of the the PT. And then for anyone who wasn't a former PT patient, we help them set up the exercises. We make sure that they are not overexerting themselves, but that they're still engaging in the proper level of physical activity to improve and just help them keep moving towards their goals, just providing guidance and support every step of the way.
Wow. You know, I stopped by when I met Alex. Came to our practice and gave an informative talk, and I said, gee whiz, you know, I've got to get by where you work. And so I went by, and I went by twice just to see the facility, and then one more time to ask him to twist his arm to come tonight. But both times I saw people I knew there, and their common thread was, we love it here. We love it here. It's a great place to exercise. They felt comfortable, obviously well taken care of, and you know, it is strictly personalized. So, you know, and folks, they have land, and they have a pool there.
Absolutely.
Can you tell us how that is utilized in exercise and helping your patients?
Absolutely. So the land-based is a little bit more of the conventional training that you think of, the use of cardiovascular equipment, resistance training, body weight training, whereas the pool allows us to get the individual in the water, and as many of you are aware, when you're in the water, buoyancy takes effect. Many of us can, you know, float on the surface of water. When someone is in the water exercising, however, that buoyancy helps to relieve weight and impact on particularly the lower extremities. So if we have anyone that has mobility limitations for knee, hip, ankle, exercising and moving around in the water gives them a range of motion and mobility that they otherwise wouldn't have. It also aids in allowing those that, you know, may not be able to be active for long periods of time. With that body weight reduced through buoyancy, they can now be active for longer periods of time and be more active than they would be with strictly land-based training.
Okay, super. Well, folks, there it is. I mean, you know, you've got somebody who can personalize your exercise plans based on some of your limitations. And
Absolutely.
so that's not seen in every exercise facility around town. Well, you know, I think, thank you, and we'll go ahead and get started, and we're going to be talking, the initial point was obesity, but before we get to that and how exercise can impact that, you know, I think one good way to start off is just exercise for some people, Alex, is kind of a dirty word. It's almost a four-letter word, but we won't go there. We'll just say, for some people, it's difficult. How would you define exercise in terms of our average patients and people in our community?
So to define exercise, you first really have to define physical activity, because there is a distinct difference between the two. Physical activity is any type of bodily movement that increases your energy utilization over rest. It doesn't have to be, you know, going out for a run or anything of that nature, you know, lifting weights. Physical activity can be something as simple as walking the dog, or doing some gardening, or doing housework. Anything that is going to require more exertion than just sitting on the couch and relaxing. Now, exercise, on the other hand, is physical activity that is planned, structured, and often has a repetitive nature. So repeatedly lifting a weight, repeatedly, you know, covering a set distance. All exercise is physical activity, but not all physical activity is exercise. So again, for our members that come in the facility where they are exercising, they are carrying out physical activity in a way that is planned and structured with a set goal or a set duration in mind.
Ah, interesting.
And that can encompass many different things. The conventional, you know, weightlifting, cardiovascular exercises that we all think of when we think of the word, you know, gym or fitness. But even going out for a walk and saying, you know, I'm going to go out and walk for a mile. It is structured. You've got a goal in mind, and that would then constitute exercise.
Interesting. You know, what do you think are some of the key elements as somebody is thinking about, gee, my doctor's suggested that I exercise, or I've read about it in a magazine, it might be preventive, it might help me with my medical challenges. What do you think are some of the key elements? Because, you know, I'm thinking, so it may not matter where it takes place, because you've mentioned, gee, it could be walking the dog.
Absolutely.
So what do you think are some key elements in terms of, again, exercise? Maybe we're unpacking that it's not such a dirty word.
So some of the key elements are that, you know, for one, it doesn't have to be a dirty word. The easiest way for someone to become more active and to make exercise easier is to select a type of exercise or physical activity that you find enjoyable. Many leisure type activities, you know, I for one enjoy going walking the dogs, going hiking with my brother, and that kind of leads in the fact they can be social activities. I know that that's been difficult for the last year, but there are ways that you can turn exercise into a safe yet still social activity, which can significantly improve how enjoyable it can be.
Interesting. You know, you probably did, it sounds like you did some of this down in Greenville, but you know, one of the things that the advantage of, because my practice is based on personalized, individualized healthcare. You know, it's great for us to know population-based data and population-based information, and that's great. That's a good start, but then you hone it down to the individual that's in front of you. And you know, I'm curious, you know, the Zumba classes that you see and the classes, you know, they look like a lot of fun, and I think it's a way for somebody that really, really likes that socialization. Now with COVID, that changed considerably changed things. You know, we're all hoping, folks, we can get back to some sense of what used to be. But could you contrast the utilization of kind of group activities in terms of exercise, where that could fill a niche versus, again, the personalized, you know, more one-on-one, one-on-two kind of?
So there's certainly pros and cons of both. One of the benefits of exercise classes, things like Zumba, group circuit training courses, is obviously the social aspect. You are with others that are all engaged in the same form of activity. That can give you a sense of support that you otherwise wouldn't get with just individual exercise. And they tend to be very engaging. For someone who tends to, you know, drift away from physical activity due to the, you know, potentially solitary nature, something like that can be a very powerful motivator. One of the drawbacks is, though, is there is a less personalized approach to exercise classes. Now there's a variety of different classes, so you can select a class that fits your interests or your goals. You know, a circuit training or an interval training class if your goal is, you know, to shed weight and build up your muscular strength and endurance. If you're looking for more coordination or balance, a Zumba class would be right up your alley. That's one of the reasons why I never did much Zumba, because my coordination's a little so-so when it comes to
I think
moving.
I'd be on the back row.
Yes, that's generally the way I would do it when I was taking those classes.
Nobody look at me.
Precisely. But the individualized exercise does allow you to tailor things a little bit more towards your individual goals. For someone who is self-conscious about engaging in exercise, the individualized exercise is much more comfortable.
Right.
You don't feel like you're surrounded by a bunch of people who are comparing your abilities to that of their own. So I would encourage anyone to absolutely try both and see which one they feel they're more comfortable with and which they enjoy more, and that will help guide them as they continue to become more active.
You know, I'm gonna pick up on something that you just mentioned. That's being self-conscious. You know, I think a lot of folks who are overweight and then maybe going even further than that, maybe in the obese category, do feel that self-conscious image issues. And let's talk a little bit in this first segment. Can exercise and physical activity, can it help people that are stuck with too much weight in all the wrong places?
It can. So weight loss a lot of times comes down to intake of calories versus energy expenditure, how many calories we are burning through activity. Any type of physical activity or exercise is going to result in the burning of more calories than sitting at a resting level would. So whether that is going for a run, whether that is lifting weights, doing a Zumba class, or even walking the dog, anything that gets you up and moving can help facilitate weight loss. The important balance to try and strive for, though, is trying to exert more calories than you're taking in. excess calories your body will store and save for later, often stored as body fat, versus if you're expending more calories than what you're taking in, your body will start to utilize that stored energy in the body fat, and that weight can be shed by engaging in that activity.
Okay, all right, very good. In terms of, you hear this term and it may be, is it really important to understand aerobic versus anaerobic exercise, or is that just a scientific distinction and most of us don't need to understand?
It's very important actually. So aerobic type exercise is usually what we think of as a more moderate intensity, but usually a longer duration exercise. Something that you can do and sustain for an extended period, 20 minutes, 30 minutes. An anaerobic type of exercise is one that is generally going to be much higher intensity. Your body will utilize different fuel substrates. So anaerobic exercise, it actually utilizes sugar, which is stored in your muscles and your liver as something called glycogen. During these higher intensity exercises, that is what's primarily being used for energy. It also has a lot of byproducts such as carbon dioxide and lactate. That's what causes that burning sensation in the muscles during high intensity exercise. So it is a very important distinction because they each carry with them different benefits. Depending on the individual's goals, they may want to focus on one type, or aerobic versus anaerobic, or anaerobic versus aerobic. So it definitely plays into the individual's goals.
So is it possible as a exercise physiologist who's got who has your patients, your clients, do you sometimes mix these two within a session?
Absolutely. So most higher intensity weightlifting exercises are going to lean more into the anaerobic type of exercise. Things like a circuit training. So we'll often set up our members on about a 16-minute circuit, which will consist of 4 different exercises as they rotate through these 4 for 16 minutes. And that is using more of the glycolytic system, that anaerobic metabolism. On the other hand, a lot of times when people come in, they do an aerobic warm-up. Because this is a more moderate intensity, it allows you to build up to that anaerobic bout at the end by using a piece of cardiovascular equipment or more moderate type intensities.
Okay, very, very interesting. So, I had a patient today, it was very interesting. We had seen him within my practice, 1-year interval, and his weight has remained almost the exact same, but his body composition, he went from 30% body fat down to 22%. So he's really made some changes in his body composition. But his weight didn't change on the scales. So is that a good thing? Is that something that's maybe typical for somebody who might be entering into exercise as a mode of trying to lose weight?
Yes, so absolutely. So
And is that good?
It is. So body composition isn't just how much body fat or just the number that you see on the scale. Body composition really is made up of 3 primary components. You have your fat mass, which is body fat that is consisted of fat. You have your fat-free mass, or your lean mass, which is going to be muscle mass, organ tissue. And then some calculations will also take into account bone density, which is part of your body composition. So what you've described with your patient, despite his weight not changing, he's obviously lost a significant portion of body fat. What that indicates to me is that his loss in body weight, or his loss in body fat, has also been accompanied by an increase in that lean muscle mass. So while he's losing body fat, he's also putting on lean muscle mass, which is very important for carrying out activities of daily living and just maintaining an all-around level of fitness and health.
Sure. And just to give the last page on this, his insulin resistance scores went down. His lipid levels, his cholesterol levels went down. So he's definitely more healthy, and I was excited for him. After we got past the fact that your weight hasn't changed, but then we looked at the other. And that's something we do standard in our practice. We will analyze your body composition and talk about that, not just about your weight. Well, folks, I think we're going to be taking a break shortly. We are live this evening, and please get your phone calls and your questions ready, because I've got an expert in the house here with us. So we'll be right back in just a few minutes.
Welcome to Davis Furniture Company in historical downtown Rocky Mount, where we treat our customers like family. We have 16,000 square feet of floor space for furniture and accessories to help make your house a home. For over 30 years, we've believed in offering quality furniture at the best prices with strong customer service. We also offer in-store financing, delivery, and something you won't find anywhere else. We truly love our customers. We pride ourselves in our relationship with you. Come by and see the Davis difference at Davis Furniture Company.
Chevrolet has put over 100 years of truck building know-how into the 2021 next generation Silverado, America's favorite truck. Don Bullock Chevrolet has put over 100 years into building the area's favorite dealership. If you're looking for a truck, choose Silverado. And the dealership to buy from? Don Bullock Chevrolet.
The tank is on E, and your low tire pressure light is glaring at you again. You do not have time to wait in line and pay to put air in the tires, and you certainly don't want to get out of the car in the cold and pump gas. What if you could pull up to a gas pump and have an attendant run out to greet you to pump your gas, clean your windshield, and put air in the tire, all for no extra charge, while you step inside and enjoy a made-to-order breakfast or lunch? Does that kind of full service exist anymore? It does, at JD's Grocery & Grill, a service station created to bring back the full service experience to all customers. JD's Grocery & Grill is a full service gas station, eat-in restaurant with tasty made-to-order food, and a grocery store all in one. The staff at JD's Grocery & Grill is ready to field all requests and will help you find anything you need. Call them today at 252-972-5000 or stop on by at 1240 Atlantic Avenue. Store hours, Monday through Saturday, 6 a.m. to 6 p.m. Grill hours, Monday through Saturday, 6 a.m. to 2 p.m. JD's Grill & Grocery, at the heart of great food.
All right, welcome back, folks. Dr. Richard Michael here with MDVIP, and my special guest in the studio is Alex Babineau. He's a exercise physiologist, certified through the American College of Sports Medicine, and he works with Kelly Singlair at Manual PT. And they have quite a facility there. We talked about that in our earlier segment. Okay, Alex, here we go. We've got folks lined up. They want to come on in, but they really want to lose, 5 to 15 pounds, really kind of tone up a little bit, lose this. They're raring to go, but they'd really like to lose it by in the next 3 months. Is that a possible goal? Do you see that as pie in the sky? If people came to you with that goal or that time frame, how would you approach it?
So it's certainly a doable goal in that span of time. The trick with weight loss of that level in that period of time is going to be to do it sustainably and steadily. We will frequently see people that they'll lose a lot of weight, kind of this yo-yo effect where you lose a lot of weight, put it back on. It is much better in the long term to lose that weight in a slow, consistent fashion. So if you're talking about a period of 3 months, 15 pounds, even losing a pound to a pound and a half a week is a very steady and doable way to go about it. And as long as you use a combination of good diet coupled with physical activity and exercise, it is something that can be done. It can be done quite safely as well.
Awesome, awesome. You know, one of the challenges I find in my practice, and I'll be curious about what challenges you find in yours, is you know, determining, well, what do you like to do? I always ask that of the patients, and you know, are you an outdoor exerciser or an indoor exerciser? I always like to kind of figure that out, because there are barriers to exercise.
Absolutely.
You know? We're going to talk about the benefits to exercise in just a moment, but I'm curious, you know, I see barriers to exercise. It's just too cold out. It's too hot out. It's been raining. It's too dark. It's whatever. Now, you know, you need to be safe where you exercise, where you do your physical activity, and that can have a bearing. But, you know, we call these barriers to this kind of lifestyle intervention. I'm curious as to what barriers have you seen in your career, and how do you try to overcome those barriers, you know, with the patient involving them?
So there are many barriers to physical activity, and one of the most commonly cited ones is lack of time. I think we can all appreciate that one. We have busy lives, and if exercise hasn't been a part of your normal routine, either before at all or for quite a while, it can be difficult to move that back into an established routine and schedule. One of the things that we do at our facility is make sure that we are using our clients' time as effectively as possible. You can absolutely get a strong and effective workout in just 30 minutes. And really, most people can spare 30 minutes a few days a week. It doesn't have to be every single day, although if you can get physical activity in 30 minutes or more every day, that's definitely a bonus. Other common barriers would be lack of resources, and that can fall in terms of, you know, it's raining outside. If your plan was to go outside and walk, you no longer have the resource to go out and walk in the environment that you had planned to. When we unfortunately had the COVID shutdown last year, a lot of people were not able to go to the fitness and the facilities that they would normally use to facilitate their exercise and physical activity needs. Really talking with our members and just coming up with coping strategies and ways to work around whatever barriers that they have identified or we can help them identify that stop them from being active. The trick is to find workarounds that are going to work for that individual. And everybody's different. Everybody has different lives. We have different obligations that we need to carry out. Some of us are parents, some of us work long hours, and some of us work multiple jobs. But generally speaking, with the right approach, almost anybody can factor physical activity into their life. It just takes a specialized approach.
Okay.
We have a question. This lady said her mother is coming home from the hospital, and she wants to know, they have advised physical therapy for her at home, but she wants to know, she's 78, and wants to know, would your place be a place she could get physical therapy?
So physical therapy is a bit different than what we do with the Wellness Center.
Okay.
Physical therapy is more geared towards the treatment of pathologic tissue, so whether that's injured tissue, whether this is, you know, a source of pain or discomfort for the individual. Now, we do occasionally work with folks that are in physical therapy. I know if somebody is in physical therapy for, you know, a recent knee replacement, they can absolutely come to our facility and work on other aspects of their fitness that won't work that knee that's currently undergoing rehabilitation. I would say it would depend on her mother's unique circumstance. The types of activities that they have given her clearance will definitely influence whether or not our facility would be a good fit, or if she should consider waiting off until she's been cleared and she's completed her physical therapy and then can go on to engagement in a wellness center like ours.
All right. Well, let's switch gears just a little bit off of obesity and wanting to lose weight just because of how it makes me feel, how it makes me look. But let's talk about some actual medical disease challenges that people have. You know, one of the things that people have challenges with in our culture is, I'll use the word diabetes because that's a catchword, but also pre-diabetes, and I think there's a huge population that's in that category as well. Folks, pre-diabetes is where your blood sugar levels are not quite as elevated, but you know, I call it the neutral zone. I call it the in-between area. And you know, you just don't want to fall into the diabetic zone because it really has major ramifications for your future health, for what's going on with you. So what about exercise? You know, oftentimes we think of diet, and certainly has a big role there. But what about exercise with your pre-diabetic or your diabetics?
So exercise is actually a very effective way to help manage and even prevent diabetes. So as we all know, diabetes is caused by excess sugar in the blood, whether that is due to a resistance, where your body no longer responds as strongly to insulin, or in a type 1 diabetic, someone who their body has lost the ability to produce insulin. When you engage in exercise, your body is consuming energy. So we talked earlier about your body using sugar as a fuel source to fuel exercise. While you're engaged in exercise, the excess blood sugar that is circulating in your body can be used as an energy substrate. So many diabetics, or those that are pre-diabetics, can engage in moderate intensity, prolonged bouts of exercise, so think 20 to 30 minutes, and that can help them keep their blood sugar low or lower than it would be without that exertion through physical activity or exercise. Many of the risk factors for diabetes are also affected by exercise and physical activity. Excess weight management. We know that there's a big link between physical activity and body weight and sedentary behaviors. So yes, if someone's looking to manage their diabetes, or if they're trying to prevent them from progressing from a pre-diabetic to a diabetic, I would strongly encourage them to engage in physical activity or exercise.
Yeah, you know, on our program, I've said this a few times before, you know, one of our goals in personalized healthcare at MDVIP is to actually have the time to talk to you about a personalized diet, or nuances in that, or recommending physical activity, exercise. And you know, one of the misnomers is that doctors only want to write a prescription. Get this prescription filled, get out of my office. You know, we, on the other hand, really take this approach that if we can win by lifestyle, boy, we're high-fiving in the office. We are just enjoying it, because folks, with pre-diabetes, there's a medication called metformin. It's approved for pre-diabetic control. But do you know that the ability to keep you from going into a diabetic state using that medicine is not nearly the same prevention rate as with exercise? So lifestyle and exercise play a tremendous role in that.
Have another question. They want to know what the hours are, and do you need an appointment?
So our facility is open on weekdays. We open at 8 o'clock in the morning, remain open until 7 p.m. We do close a little bit earlier on Fridays at 4 o'clock. You do not need an appointment to stop by and check out our facility. By all means, come on through. We'd love to show you around and show you what we have to offer, if you like what you see. And then at that point, you're interested in trying a complimentary training session, kind of seeing what a normal day in the life at our facility is like, then we would make an appointment. All of our trainings currently on hour-long appointments. Helps us maintain social distancing, as well as making sure that we have a good ratio of 3 or 4 members per one training staff member. That way we can make sure that we're giving everybody the attention and the assistance that we strive to offer.
That's fantastic. You know, that's right in line with what we do at our practice. Your wait time to see me is like 5 minutes, so it's not the traditional 1 hour. And you have 30 minutes with me in terms of follow-up, not the traditional 8 or 9 minutes with a doctor. So there's a lot of similarities between what we try to do with our patients, and I think it really comes back to what Alex has mentioned a few times already, that it's the personalized approach. It's not the cookie cutter, you know, you're going to be lost in the crowd type of thing. So I think that that's really encouraging that you do that with your clients. Let's talk about a few other topics. What about high blood pressure? You know, if I have high blood pressure, do I need to be scared of exercise? Because, you know, I've heard that, you know, when you're exercising, your blood pressure may go up a little bit while you're exercising. I mean, what are there things I have to kind of be a little aware of, or in the long run will sustained, regular, as you said, exercise help my condition?
So sustained and regular exercise can help mitigate high blood pressure and help bring that down. For someone who is currently suffering from high blood pressure, they can safely engage in exercise, but there are certain things that they should avoid. Certain weightlifting movements, one commonly known as the Valsalva maneuver. Many of us have done this when we go to lift a couch or a heavy bookcase. We brace ourselves, hold our breath, and squeeze our stomach. In doing so, what we're doing is almost creating a natural weight belt to help stabilize our spine when we're anticipating lifting something heavy. The only problem with this movement is it can cause a very large spike in blood pressure. And when you have someone who already has elevated blood pressure, that can be inadvisable and can be dangerous. So what we try and do is teach people proper lifting technique, exhaling as they exert themselves so that they don't see that large spike in blood pressure during a resistance or a weightlifting movement. But other exercises, more aerobic type, things like cycling, walking, even, you know, light jogging, brisk walking, those are all things that somebody with high blood pressure can do and can do safely.
Wow, that's fantastic. You know, one of the interesting statistics I saw was we talked about weight loss. Mm-hmm. For almost every pound of weight loss, there can be a reduction in systolic blood pressure by 1 millimeter of mercury. So, you know, folks, exercise, I hope what you've heard so far this evening before we go to our next break is that exercise can be an integral part of preventing medical disease, in helping someone treat it, and quite honestly, if you want to find a way to get off of some of your medicines, you've got to think and really think through, how can a personalized exercise approach help me? Because folks, it can help you, and it will help your physician, those that are taking care of you, to actually give you a high five when we say, would you be interested in reducing one of your medicines or getting off of one of them? Folks, it happens, but it has to be intentional. And that's what we want to do. We want to intentionally bring about your best health. So again, we'll be breaking in just a moment. Come back with some questions, and we'll dive a little bit deeper maybe into exercise and what it does in the body.
Welcome to Davis Furniture Company in historical downtown Rocky Mount, where we treat our customers like family. We have 16,000 square feet of floor space for furniture and accessories to help make your house a home. For over 30 years, we've believed in offering quality furniture at the best prices with strong customer service. We also offer in-store financing, delivery, and something you won't find anywhere else. We truly love our customers. We pride ourselves in our relationship with you. Come by and see the Davis difference at Davis Furniture Company.
Chevrolet has put over 100 years of truck building know-how into the 2021 next generation Silverado, America's favorite truck. Don Bullock Chevrolet has put over 100 years into building the area's favorite dealership. If you're looking for a truck, choose Silverado. And the dealership to buy from? Don Bullock Chevrolet.
The tank is on E, and your low tire pressure light is glaring at you again. You do not have time to wait in line and pay to put air in the tires, and you certainly don't want to get out of the car in the cold and pump gas. What if you could pull up to a gas pump and have an attendant run out to greet you to pump your gas, clean your windshield, and put air in the tire, all for no extra charge, while you step inside and enjoy a made-to-order breakfast or lunch? Does that kind of full service exist anymore? It does at JD's Grocery and Grill, a service station created to bring back the full service experience to all customers. JD's Grocery and Grill is a full service gas station. Eat in restaurant with tasty made-to-order food and a grocery store all in one. The staff at JD's Grocery and Grill is ready to field all requests and will help you find anything you need. Call them today at 252-972-5000 or stop on by at 1240 Atlantic Avenue. Store hours, Monday through Saturday, 6 a.m. to 6 p.m. Grill hours, Monday through Saturday, 6 a.m. to 2 p.m. JD's Grill and Grocery, at the heart of great food.
Well, folks, thanks for joining back with us. This is Dr. Richard Michael with MDVIP, Value in Prevention. And with my special guest, Alex Babineau. He is a certified exercise physiologist with manual PT. And we've been just kind of bantering around the idea of how exercise and physical activity is not only a nice thing to think about, but it can impact your health in huge ways, huge ways. And we were just talking at break about patients who are able to do things like lifting groceries, going up a flight of stairs, not winded. I have a patient that we've taken just about, well, in fact, we have taken him off of all his blood pressure medicines because he's lost about 55 pounds. And literally, he doesn't need those blood pressure medicines anymore. Great wins, great wins. But folks, we're going to talk a little bit about a few other things that one of the things that's really hit a lot of people, Alex, during the COVID era, so to speak, is isolation, people being frustrated, people being worried, people looking at the TV, not being able to socialize with family. I mean, quite honestly, it's been a time of depression, anxiety. These are emotional things, but they're important things. Can exercise, physical activity, have any bearing on those types of things?
Absolutely. So one of the more recent and emerging sources of research in the field of exercise science is now scientists looking into the relationship between physical activity, exercise, and mental health. So one of the most commonly cited benefits of exercise in this regard is reduced feelings of anxiety and depression. And there's many different theories for why this is the case. For one, exercise can release neurotransmitters that are, the feel-good chemicals. We've all heard of that the runner's high, those endorphins that they get from a high bout of exercise. It also stresses your body in a controlled and manageable way, which can theoretically reduce the body's stress response to stressful situations in daily life. And it can just serve as an outlet, a way for you to work off your stress, finding something constructive to do with those feelings and with that time. And in a social setting, you can also gain yourself social support, which can help with those feelings as well.
One of the things that happens as we age is that we tend to lose muscle mass.
We do.
And I think about people becoming more unsteady, becoming more, if you want to use the word frail or liable to fall. How can exercise, physical activity, help in ways that no diet or other intervention might be able to help those folks?
So the loss of muscle mass that we see amongst aging populations, which becomes much accelerated after age 60, is referred to as sarcopenia. It's the gradual loss of muscle mass. And part of this is due, in fact, to as we age, we tend to be less active. As we're less active, we're utilizing our muscles less. And if muscles aren't maintained through physical activity and exercise, they will tend to atrophy in the same way that a weightlifter or a bodybuilder who's using their muscles to a high degree will see an increase in muscle mass. The same is true with disuse. Anybody who's ever had a cast taken off can tell you the difference. You can look at your arms and see how one has atrophied after just a few weeks or maybe a month of disuse. The increased risk of falls among seniors is in part due to the loss of muscle mass and strength, the inability to support the body weight when subjected to external forces. You slip or you trip over something or something bumps into you. But the risk of fall can also be heightened by lack of or degradation of balance and slowed reaction time, all of which can be improved through engaging in physical activity and exercise. You can improve balance the same way you can improve strength and endurance. You can improve reaction time the same way as any other aspect of fitness. And that, coupled with improving strength, can reduce that loss of muscle mass and decrease the likelihood of a fall, or if someone was to have the misfortune to fall, they would be able to not sustain the same level of injury that they might if they weren't active.
Oh, interesting, folks. So, exercise is, again, an incredible tool to help us all prevent things and to deal with things from happening, and then once they've happened, how do I not have this happen another time? So that's incredibly beneficial. What about with lung diseases? A lot of people do have various lung diseases, associated with smoking, what we call COPD. They just have really lung challenges, and when I think of exercising, some people might think that's a barrier to doing that. I can't even get enough wind to walk to the bathroom. Can exercise training help those folks?
Absolutely. So training the lungs, the majority of your body is reactive. By stressing a body system, whether it's the heart, whether it's the lungs, the muscles, you can have your body start instituting adaptations or changes due to stress. So in the same way that exercising the bicep of your arm can cause that muscle to become stronger and more resistant to external forces, by engaging in exercise, you can improve things like lung capacity, the elasticity of the lungs and the diaphragm that's responsible for inspiration, expanding the rib cage to bring in a breath. Many of those principles are what we see in pulmonary rehab facilities. That's why when you see someone that's beginning to show signs of COPD, their physician will often advise them to enter a pulmonary rehab facility to help stave off the progression of that illness.
Oh, that's excellent. That's excellent. I thought in our last remaining minutes of this evening, what we could talk about, I think it's very, very interesting to think about. We've talked about organ systems, the heart, lungs, diabetes, global metabolism, but it's kind of getting very intriguing with a lot of the advances in science that we're getting down to the cellular level as well. We're made of over 70 trillion cells, folks, and those cells are organized into what we call organ systems. But it's fascinating to kind of get into a little bit deeper dive about, really how does it work? I mean, we know that exercise is one of the leading ways to lessen all-cause mortality. And that's a huge thing, folks. What we mean by that is, when medications are studied, it may be looking at a certain form of mortality. It might be from lung disease, it might be from heart disease, it might be from strokes. But talk about a Swiss Army knife. You know, to just say across the board, all-cause mortality can be decreased through exercise is an amazing statement. And I've read that in several articles that I read preparing for this evening. So, you know, I'm interested in your take. And I know this is investigational, but I'm curious where things stand in terms of, you know, a cellular approach, kind of getting down into that level. What is exercise actually doing to help our cells?
So many of the changes that we see to the body as a result of exercise, things that are observable with the naked eye, are the results of cellular changes. These small changes to the cells of our bodies go on to, you know, depict and, you know, not mitigate, to show themselves in ways that we can observe. So things like, you know, very simple and easy one for most folks to understand is the muscle cells of any muscle that is being trained. If they're subjected to, you know, extreme forces, the body will start to increase the size of those cells in order to make them more resistant to high degrees of stress. That's where we see muscles increase in size with training. We've also seen that the body will recognize heightened levels of things like lactate in the blood, these byproducts that are produced by engaging in exercise. And your body is very good at almost having its own set of internal thermostats. When something starts to get thrown out of whack, the body will respond and correct. And while some of these can be caused by, you know, things like chronic disease, chronic illness, some of these, you know, short-term changes to the body's composition are caused by exercise. Changes in hormone levels, oxygen concentration, carbon dioxide concentrations. And that can, you know, like I said, show itself in many different ways that have great impacts on our health and our longevity.
It's quite interesting, really. You know, there are so many things that cause us to have what we call oxidative stress. And, you know, how do we manage that? You know, at a cellular level and at, let's say, in the muscles, for instance, you know, being able to drive glucose, you know, the proper way, you know, into the muscle, getting it out of circulation, so to speak, right, where it can cause havoc. You know, that's an amazing thing, and it makes that sensitivity, that ability to drive that sugar into the muscle is an amazing thing, and it's happening at a cellular level. You know,
Absolutely, and the body's, you know, it can increase its ability to utilize oxygen. It's, you know, for someone who's training aerobically, your body gets much more efficient at pulling oxygen from the lungs and getting it into your bloodstream, where that oxygen can then go and help facilitate your metabolism, allowing you to perform work, whether that's work in terms of exercise or even repairing damaged tissues. When your body heals from a cut or a wound, oxygen is required for those cells to carry out their processes to divide and repair the body.
That's amazing. You know, folks, one of the things that I'm aware of, and again, you know, this is not a medication, although it needs to be prescribed in a proper way by somebody knowledgeable, and that's why I brought Alex on board tonight. You know, one of the things that is intriguing to me, and we'll talk about this in future broadcasts, is how the body maintains excellent function at the cellular level. And you may think this is medication. No, it's not medication. It's actually supplements, and we'll have a segment in a couple of months probably on that as well. So folks, you know, we've covered quite a breadth here. Why do you think, you know, we've covered all the reasons why exercise can be beneficial, you know, both from a prevention standpoint, from, you know, I'd like to look a little bit better, I'd like to feel a little better, all the way to handling very, very well chronic disease processes. Well, why would anybody quit exercising? Do you ever find folks that have benefited and then they quit? What happens there?
So Again, life is ever changing. Barriers the same way that any aspect of your life can change. The barriers that we encounter, you start a new job, it requires you to work longer hours, that leaves less time available for physical activity. One of the most common reasons why someone would be active and stop is if they were to become injured. That can be very, very detrimental to motivation. You've worked so hard to increase your fitness and become healthier. If you encounter an injury and you're laid up and you can't exercise, or you can't do the exercises you enjoy for several weeks, when you return to physical activity and exercise, you may find that you've backslid a little bit. And that can be very tough for some people. I myself am coming off of 2 weeks off for a light shoulder strain. And it can be very difficult to get the motivation to get back into it. My recommendation to anybody would be try to overcome any new barriers that life throws you. If it's an injury, try to work around it. Again, my shoulder was injured. It didn't stop me from going out and doing some light jogging and walking with the dogs and just doing something. And something will always be better than nothing when it comes to physical activity. Well,
that's awesome. That's awesome. Well, folks, thank you so much for spending time with us this evening. We really appreciate it. Remember that the signpost for this evening has been personalized healthcare. And at MDVIP, that's what we specialize in, personalized care. Alex, it sounds like you do the very, very same. So we wish you the very best of health, and we'll see you next time.
Buying a Toyota should be as fun as driving one. This is Trey Turner from Rocky Mountain Toyota, where we've made the car buying process simple. Get straightforward pricing on all your favorite Toyota models, so you can skip the hassle and the haggle and get back on the road in no time at all. Plus, enjoy the peace of mind that comes with our complimentary lifetime warranty, unlimited time, unlimited miles. Come see me today at Rocky Mountain Toyota or shop online at RockyMountToyota.com.